Good afternoon, everybody, and welcome to the NIHR INSIGHT programme for the East North Cumbria launch of our Master's Scholarships. It's great that we've had such interest in this, I think, really fantastic opportunity. My name's Annette Hand. I'm a clinical academic professor of nursing in the North East, Northumbria University and Newcastle Hospitals Trust, and I'm the director of the INSIGHT programme for the North East and North Cumbria, so welcome this afternoon. We will be recording this, so please keep your cameras off if you don't want to be seen. We will also be sharing the slides, and the webinar will be posted on our website so that people who can't come this afternoon can have a look at it and have a look at the information that we're providing today. I would really like to introduce some other members of the team that I've got with me. So I'll start with handing over to Jo. Jo, would you introduce yourself, please?
Hi everyone, welcome to this afternoon. We're going to talk probably for about half an hour in a bit of detail about what's available for the funded masters, and then answer questions at the end. So if you've got any questions, if you want to just write them in the chat, and then we'll get to those later on. But welcome.
Brilliant, and I can hand over to my colleagues at Northumbria. Phil, if you're there.
Hi folks, yes, I'm Phil Hodgson. I'm an assistant professor here at Northumbria in health research, and I'm here today to talk about the MRes in healthcare professional practice.
Thanks, Phil. And can I then hand over to the Newcastle team, please? I'll start with Mark.
I believe Mark might have some trouble getting back into the Zoom meeting. So if I can make a start for Newcastle University, I'm Marieke Eemons. I'm the curriculum director for the master's program that we run in Newcastle University, where we have a certificate, diploma, and masters that you can flexibly follow. And I've joined here today by Alison.
Hi, my name's Alison Clapp, and I am the degree program director for the Masters in Clinical Research.
Thanks.
At Newcastle.
Thanks, Alison. And then John as well, please.
Hi, everyone. My name is John Franklin, and I'm the course leader of the MRes at Teesside University.
Brilliant. Thanks, John. Okay, then. So this afternoon, we're going to go over, let's try if I can move my slides. Okay, so this afternoon we're going to go over a quick introduction to what INSIGHT's all about, and particularly what we've got available up in the North East and North Cumbria. We're going to talk about the details of the scholarships we've got available for the research and masters, including eligibility funding and also the funding that's available. We'll do an overview of the master's programs by each of those programs that you've just heard from there, and then we'll also give you a bit more detail about applying for scholarship and the process and the timeline. As Jo said, if you've got any questions at all, please put them in the chat, and we're going to try and leave as much time at the end as possible to go through your questions. So let's start then. So the INSIGHT is funded by NIHR, which is the research arm of the NHS, and there are 12 INSIGHT regional programs. Due to the election that's coming up, unfortunately, the INSIGHT programs haven't been announced or launched as yet, but we have been given permission to talk about the offer we have on today. But this is a part of the NHR's Academy's £30 million investment, really, to expand the portfolio of training career developments for health and social care professionals across the country. What they're trying to do is target underrepresented groups and trying to increase diversity of people entering and pursuing careers, particularly around research. They would like to have more nurses, midwives, and allied health professionals and other registered professionals, public health and social care practitioner academics joining the research workforce. So Waljit, who's our Dean of NIHR Academy, has talked about this vastly increased effort to attract and support underrepresented groups into research careers. And certainly for me as a clinical academic, I came into clinical practice and spent a number of years in practice before I kind of thought about research. What this scheme's trying to do is trying to attract people much earlier on and to enable them to take on activities and learn how to get those skills and training in research much earlier in their careers, which I think is a really fantastic opportunity. You'll hear more about the INSIGHT national programme coming up after election, but it's great that we've got the regional practice up and running. What I will say is we've had to do this bit at pace and speed over the last few weeks. We were hoping to hear about the, our award outcome much earlier on the year, but we've only just really heard about it the last few weeks. So we've really had to work quite quickly to pull all this together. So I do apologise for the tight timeframes around Masters this time around the opportunity. But as I'll talk about later, there will be other opportunities coming up in the future. But yeah, we do apologise, and I'm very much learning on our feet still and learning from the other centres around the country. So the North East for North Cumbria Insight programme covers the whole of the region, as you'll see from the map. And what we've got is we've got 5 partner HEIs. That's Northumbria University, Newcastle University, Teesside, University of Cumbria and University of Sunderland all coming together. And within our team, we've got representatives from each of those areas, as well as NHS and non-NHS representative partners. And what we're doing is we're reaching out to all organisations, institutions across the region with healthcare professionals who work within those. So again, this is a massive kind of regional effort that we've got going on here, and it's great that we've kind of joined up in partnership across all the major HEIs across the region. And for ourselves up here in the North East and North Cumbria, really our ambition is to inspire students and early career health and social care residents to engage in research, really from the start to pursue a career early in their research training. And what we want to do is deliver an innovative and inclusive programme. And we're going to do that by having a load of activities of engagement and also these research master scholarships to develop and enhance research careers. What we've got is a whole range of professions involved in this, so it's great that we've got such a wide range and reach with professions. And when we've mapped across the whole region, we've got over 16,000 undergraduate students from across 50 different programs in health and social care across those 5 HEIs, which is a massive amount of individuals, as well as our geographical reach. It's kind of a really large area that we've got. And I'm delighted to report we've been able to secure 90 research scholarships over the 3 years, so that's 30 each year. And those are going to be delivered across 3 universities that you can hear about today to really help stimulate and inspire students and early career registrants, which is great. On the right-hand side, you've also got Research for All, Research Community, and research support and mentorship. And those are some other activities and engagement events that we're going to be having over the course of the next 3 years. And you'll hear more about those, over the coming weeks and months. I will refer to the 4P slide at the very end, but just to let you know, it's not just the master scholarships we've got available here. We've got lots of other events and opportunities for people to get involved and to engage in research. So let's talk about the master scholarships. So for the eligibility for this, what we're looking for are students from registered health, social work and public health professions and an early stage of your career. So this could be undergraduate or postgraduate. And what we've been asked to do is target people at the really early stages. So they're asking for people to be, really within the first 3 years of registration. If you've had a career break, though, for whatever reason, then we can extend that and have a look at that. So if you have been registered for more than 3 years and you've had a career break, please make sure you include that in your application so you can understand why you've had that career break and why you've been longer than the 3 years. Because we've got 12 Insight programs across the whole country, what we are saying for this, for the North East and North Cumbria, is that you need to be located in the North East or North Cumbria, and you need to be employed by us, or you need to be a student here currently. And then you'll see on the right-hand side there all the regulatory bodies that we're eligible to apply for this award. If you're unsure again, please get in touch. So that's the eligibility criteria. Funding. So what we're able to offer in the scholarship is full tuition fees. So that's your full master's fees paid, whether that be full-time or part-time. And the other really exciting thing is we've also been able to secure stipends for everybody who gets offered a master's scholarship. The stipends are both for full-time and part-time students. They're per annum on the pro rata, and they will cover either living expenses if you are part-time, or if you've not gone into, if you're not currently working, or if you're working, then they can potentially cover costs of your salary or contribution to your salary costs and release of your clinical time. Roughly, but if you're a full-time, the stipend is about £19,600, and for those part-time, it's about £9,000 per annum. So actually, a substantial amount of funding that's available as part of that stipend. So in all, there's a lot of funding put into each individual, which is, I think, is a really fantastic offer to support to people to go on to these master's programs. The courses that we've got on offer are over Northumbria, as we said, Newcastle and Teesside. And I said these are fully funded places. So some of these courses are full-time, some of these are part-time, and you can see there's a variety there of courses, but they're all very much focused around research as a main priority area for the Masters. And again, it's really asking everybody to have a look at what's on offer within the website. I said we'll hear from the program leads and a little bit about their courses. And within the offer that we've got within North East North Cumbria, we've got a number of places available for each of the courses that you'll see on the screen there. So what I would say is that, when you are putting an application, we are asking for you to put down your first choice of place of study on your first program. But if that place is oversubscribed or, there's lots of people applying, then we're also asking people to potentially put down a second or third choice as well, because we'd like to accommodate as many people as possible within this first round. So that's why we're asking people to put first, second and third choices are, because there are limited numbers for each of the courses that I've got available. Okay. So what I'm going to do next, I'm going to pass over to Phil to talk about what's available at Northumbria. Over to you, Phil.
Thanks very much. Thanks, Annette. Yeah, so I'm the program lead for the MRes Healthcare Professional Practice, as I mentioned earlier. So just a few little details for us. So we're a 2-year program. We're part-time over those 2 years, and we take a blended learning approach. So we have alternate weeks of teaching. The teaching usually takes place on a Thursday afternoon from 1 till 6, and then that's alternated with online learning, like online structured lectures and things like that as well. We're available to all with a registration as a health professional and a first degree at 2.2 or above. And what we try and place an emphasis on is obviously a kind of multidisciplinary approach based on people's research interests and their background and the kind of the position they want to take on their research. And we try and tailor those sessions and kind of use a scaffolding approach around that to facilitate people's development of a researcher identity and a project alongside that. So the first year has focus on methodology, methods, and research impacts. And then the second year is completion of an empirical project as a dissertation, which is obviously then given kind of expert supervision support from somebody with knowledge of the field and or methodological expertise. But yeah, that pretty much covers us. Just the kind of the key point that we are a 2-year blended learning program.
Brilliant. Thanks, Phil. Okay, then let's hand over to Mark. If you're there, Mark.
I did send him the line, but if he's not available, I'm happy to take this one.
Yeah, I'm here, but that's not. I'm public health rather than this one.
Sorry, Mark. I'll hand over to the Newcastle team, and you can talk to your side. That's okay.
It's all right. As I am the curriculum director for this program, I'm more than happy to talk to these. We have a part-time master's program that runs over 3 years. Actually, what you can do if you feel you're only up for the certificate at the moment, you can apply for that. You can apply for the diploma, which runs over 2 years part-time, or the master's, which runs over 3 years part-time. It's delivered as 60 credits studied each year with 3 modules. A certificate teaches you about the governance and integrity and data management. And then there's a writing and research module. If you feel that you really would like to have more practical experience, we also offer an experiential module, which also falls into the credentialing pathway, which is more hands-on. All other modules are delivered online and are flexible. That means we do have some teaching moments. However, everything is recorded. And if it doesn't fall into your schedule because you happen to be working shifts on the time, you can always go back to our recorded session. So it really suits for those who have got changing working patterns, like all allied healthcare professionals. We have a mix of NMHPs and medics and dentists on our courses, which makes a really nice mix of and a team mix, as you can see in clinical research. So the diploma there, you can make a choice of 3 modules, of which 1 is compulsory and the other ones you can choose to complete 3. And then the masters, you can do your own project, your own research project that is really aligned to what you're doing in your clinical practice and what you're interested in. I know there's lots of questions on the chat already about people who are a bit over their 3 years registration are living further out, we're more than happy to discuss other possibilities of funding that we can offer for some of our courses.
Thanks, Maria. That's brilliant. Okay, then. The Masters in Public Health, please.
Yeah, so I didn't get a chance to introduce myself earlier because I was struggling to find the Zoom. I'm part of the MPH team here at Newcastle University. Specifically, I'm the lead for the dissertation module, but I've been involved in a range of the areas of the course. It's a Masters in Public Health. Public health is really broad. I'm an epidemiologist. We're part of public health. So, you know, health economics, qualitative research, quantitative research. We teach all the methods for that within the first semester. And then there's optional modules depending on what students are interested in. And then the dissertation project, I'm quite proud that we're able to open up the dissertation choice to students in terms of what we're offering as supervisors, but also what students might want to do. So we actually give more choice than certainly students get at undergrad. The idea being that, yeah, as it says on the slide there, equipping you with the knowledge and skills for improving population in your future career, whichever stream of public health you go into. And I'm quite happy to talk to anyone about any of the areas of public health that we offer.
Brilliant. Thanks, Mark. Okay, and then finally we'll go over to Teesside and John.
Hi everyone. Sorry, yeah. So this is our MRes at Teesside. We offer a full-time course that's done over 12 months, or we offer a part-time MRes that's done over 2 years, which runs from September to May for each of the 2 years. Again, the course can either be attended as, can either be studied as an attendance learner or as a flexible learner. So that means you can attend all the sessions if you wanted to, or you could watch the recordings of the sessions if you aren't able to attend, and you can decide how you access the module on a week-by-week basis if you want to attend or if you want to watch the recordings. We do actually have a distance learning option as well, which is completely online, where you wouldn't need to attend anything. But often I think especially in this region, flexible learning is obviously quite a nice option where you can get those recordings and you can attend as you want to. So our course is made up of these core modules. So we do an introduction to clinical research, where we do a module on transition to mastery and developing those mastery skills, as well as introduction to evidence-based practice skills, things like that. We do a research proposal module where you'll learn those kind of key theory in developing research projects. We do a stats module where you'll talk about regressions and t-tests. We do an advanced clinical research designs module where you'll talk about evidence synthesis and developing and evaluating complex interventions. We talk about meta-analysis and how to conduct those. The qualitative module is kind of understanding the theory behind qualitative research and understanding how to interpret and develop themes. And then we do a dissertation and research article module where you'll do a dissertation, but you'll also be asked to write that up as a research article as well. So hopefully at the end of the course, you've got your full master's and a research paper ready to submit as well. So, and I put a little QR link that takes you to our Teesside University webpage as well.
Brilliant. Thanks, John. Thanks for that overview. Thanks all of you for those. Okay, then, so how do you apply for one of these scholarships? Well, we've got a deadline of the 10th of July, so you've got just under a month really that's left. All the details are on the website, and I'll bring that website up again in a little bit. It's all an electronic application process. So there's no paper-based, it's all online, please. And then the application will be asked to give us your profession, your date of registration, if you're employed, your employment details, and a little bit about research interests and why you're keen on undertaking a master's in research. And I said, we will ask you to state your first, second, and third preference, of course. If you're working, you'll also need a statement of support from your employer to agree to that, because obviously you'll need to be ensured that you get the study time and you're released from clinical duties to be able to attend or to take part and to carry on with your studies. This is the website that we've got available to you. Again, the QR code will take you to that, as well as the link below. And on the website, we've got all the details about the Insight offer we've got, what's available, all the different courses, all the links to the courses. And obviously at the bottom there will also be the link to the application form for you to follow and have a look at. So it's all on that page that you need to go to find out further information and to apply. And again, when you're applying for it, if you're currently working, I said, please make sure you've spoken to your supervisor, line manager before applying. I said that's really important, as your employer will need to provide a statement of support for your application. If you've already secured a place within the research master's courses starting September, then you are eligible to apply for funding retrospectively. So you can still apply for that and potentially get those fees covered or paid for. And if, this will be a two-stage application process. So if you're successful in this application, a place will be held for you on your given course that's allocated to you, but you will be required to undertake the application process for the relevant institution to complete the process. So there's no interview attached to that, but you will need to help with that paperwork and that audit trail and fill that out. But that place will be held for you and secure for you if you're successful with the award. So the key dates. So applications for this were opened on the 24th of May, and it's great that we've already had a number of applications. Applications will close at 5 o'clock on the 10th of July. And what we've got is we've got panels set up to review those applications and to look at those. And we're hoping to get outcomes to everybody week commencing the 22nd of July. So hopefully giving you as much notice as we possibly can for a start for the next academic year in August, September time. And as I said, I just wanted to give you a quick update about another opportunity we've just had available to us, which is called the 4Ps. This is going to be happening on Monday, the 15th of July. And this is a 3-hour course to introduce people to the research landscape and show how you can make a difference. There's a QR code there to book. And for people from Insight, if you get a place, this is again a fully funded place available to individuals. So when we share the slide, you can again have a look and book directly with a link that's on the slide available to you there. That's led by James Faraday, who's a speech and language therapist based in Newcastle. But it's a really great course. It's a really nice introduction to research if you're really quite new to the landscape. And then just finally, please get in touch if you do have any questions or queries for us. Then we've got an email address there at the NHIR Academy, and obviously keeping a close eye on that. Please link into our website, and again on the right-hand side there, you'll see the QR code to our fully funded masters, which is on the website. So please, you've got that link there available to you to go to if you want to apply. Okay, then. So I think that's all our slides. So I'm going to stop sharing